A peptic ulcer is a sore in the lining of the stomach, where it's called a gastric ulcer, or in the first part of the small intestine, where it's called a duodenal ulcer. In the United States, roughly 4.5 million people suffer from peptic ulcer disease. Some of the common causes are Helicobacter pylori infection, non-steroidal anti-inflammatory drug use, increased stomach acid, alcohol consumption, and cigarette smoking. Up to 40% of those with ulcers have no symptoms. A gnawing or burning pain, nausea, vomiting, or heartburn can be some of the symptoms. Some of the complications are bleeding internally. This is the most common complication. Or perforation, where an ulcer breaks through the wall of the duodenum or the stomach. This is a medical emergency and it requires surgical intervention. An upper gastrointestinal endoscopy is a camera that's inserted on a long tube down the stomach, and it's necessary for a conclusive diagnosis of a peptic ulcer. An endoscopy allows for the inspection and the biopsy of the stomach and the duodenum and the detection of Helicobacter pylori. A CBC and a stool occult blood test are recommended for patients who are suspected of having a bleeding ulcer. Some of the conventional treatments for a Helicobacter pylori positive ulcer, antibiotics result in a 70 to 90% cure rate. Antibiotic resistance is a growing problem though. There's also proton pump inhibitors, and these block the secretion of stomach acid, allowing ulcers to heal and often relieve pain. When used long-term, proton pump inhibitors are associated with a wide range of serious side effects, including kidney and cardiovascular disease. Triple therapy is a standard treatment, and it combines 2 antibiotics and a proton pump inhibitor. Bismuth may also be included for a quadruple therapy. For Helicobacter pylori infection, non-steroidal anti-inflammatory drug use should be discontinued. Antacids and medications to reduce acid secretion are used in these situations. Lab and animal studies indicate silver nanoparticles have anti-Helicobacter pylori activity. Silver nanoparticles should not be confused with over-the-counter colloidal silver. Liposomal linoleic acid has been shown to kill Helicobacter pylori and markedly reduce its population in the stomach of mice. In addition, liposomal linoleic acid was shown to decrease the levels of pro-inflammatory cytokines triggered by the Helicobacter pylori. A diet rich in fruit, vegetables, and fibre can reduce the risk of ulcers by 50%, and it can also help to heal existing ulcers. Fermented dairy products like yogurt and kefir appear to promote Helicobacter pylori eradication. Stress management is important, as stress and tension is correlated with gastric and duodenal ulcers. In a trial, 100 patients who tested positive for Helicobacter pylori were treated with D-glycerated licorice or placebo for 30 days. At the end of the treatment period, 56% of the D-glycerated licorice group and 4% of the placebo group tested negative for the Helicobacter pylori. In a randomized clinical trial, 86% of subjects who were treated with triple therapy alone achieved eradication, while 100% treated with triple therapy plus zinc carnosine at 150 mg twice a day were Helicobacter pylori negative 4 weeks after the treatment. Lactobacillus reuteri has been shown to decrease the Helicobacter pylori load in healthy H. pylori positive individuals, and thus it can prevent future Helicobacter pylori associated problems, including the need for antibiotic treatment. A meta-analysis examined 5 randomized control trials that evaluated whether lactoferrin treatment was effective for Helicobacter pylori eradication. Those who received lactoferrin had more than a 2.2-fold higher odds of eradication when compared to the controls. Evidence from numerous studies indicates polyphenols, like flavonoids, hold a promise in the prevention and the treatment of peptic ulcers. Extracts from tea, apples, pomegranate, and grapeseed are especially good source of polyphenols, with possible anti-ulcer and anti-Helicobacter pylori activity. A peptic ulcer is a sore in the lining of the first part of the small intestine. Ulcers in the stomach are called gastric ulcers, and those in the upper small intestine are called duodenal ulcers. Symptoms include pain, nausea, vomiting, and heartburn. In serious cases, ulcers can cause bleeding in the stomach or perforation of the gastrointestinal wall. In the US, roughly 4.5 million people suffer from peptic ulcer disease, and about 500,000 new cases are reported each year. The most common cause of peptic ulcers are infections with the bacteria Helicobacter pylori and the use of non-steroidal anti-inflammatory drugs. Uncomplicated ulcers associated with Helicobacter pylori infection are usually treated with antibiotics plus a proton pump inhibitor, and this reduces gastric acid secretion and it allows the ulcer to heal. Treatment of bleeding ulcers might require endoscopic surgery. The increasing use of antibiotics in children over the past several decades has led to a decline in the prevalence of Helicobacter pylori infection among younger generations, and combination therapy with antibiotics and proton pump inhibitors is very effective for treating peptic ulcers. However, antibiotic resistance now represents a critical factor in the failure of ulcer treatment. Thus, new methods for eradicating Helicobacter pylori and treating ulcers are needed. The good news is that new scientific discoveries can improve the efficacy of ulcer treatment. For instance, integrative interventions including deglycerated licorice, zinc carnosine, and vitamin C have powerful anti-Helicobacter pylori and ulcer healing effects. Probiotics, particularly a strain called Lactobacillus reuteri, appears to help to control the Helicobacter pylori and to reduce the inflammatory response to the infection within the organism. Treatment with probiotics can also enhance the ability of antibiotics to eliminate the Helicobacter pylori infection, while reducing the drug's side effects. In addition, lifestyle and dietary changes can have profound impact on ulcer risk and promote ulcer healing. Smoking cessation, stress reduction, and avoidance of non-steroidal anti-inflammatory drugs and excess alcohol all help to promote ulcer healing and to prevent a recurrence. A diet rich in fiber and plant nutrients, called polyphenols, can protect against the development of peptic ulcers. For more on peptic ulcers, continue on this series, and for more information on herbs, supplements, and natural treatment plans, check out my website.